Now we'll go to our second speaker, Andrea KIFYASI. As I said, just finished his PhD at University of Basel and now at University of Dar es Salaam, talking about Chinese medical assistant.
Thank you, Jenny, for your introductory remark, and welcome everyone to my presentation with the topic, China's role in global health, HIV/AIDS, traditional Chinese medicine research and treatment in Tanzania from 1987 to 2014. When I was preparing this paper, I was very much interested by a book by Andrea, A History of Global Health. And I was much interested with his claim that global health interventions have been empowered by faith in the superiority of Western medical knowledge and technology, and a devaluing of the knowledge and abilities of the local populations. From this preceding quotation, Randall Packard, in other words, argues that global health interventions leaned much on Western medical knowledge, which relied on biomedicine than traditional medicine. Therefore, despite its endorsement by the Alma Mater Declaration of 1978, traditional medicine was less integrated into curbing global health challenges, and its role has been less studied. And similar to this, contributions of Southern countries in fighting pandemics were hardly unveiled. However, extensive research has been carried out on the laws of traditional global health partners in global health. Therefore, this tells that inadequacies of research literature unveiling the laws of Southern countries in global health bolded an implication that countries of the South had nothing or little to offer to global health. Very little is currently known about China's multilateral engagement in the global health from the 2000s, following its domestic health crisis and economic interests in Africa, where medical assistance became an essential component of China's projection of soft power. Although the available literature sheds light on China's global health multilateralism, research to date has not yet examined China's bilateral entry into the global health. Therefore, my paper examines the ways in which Southern countries engaged in the fight against pandemics using China's HIV/AIDS traditional Chinese medicine research and treatment in Tanzania as its focal point. The paper discusses the history of the project, context for its establishment, practice, and perceptions by patients. And the central thesis of this paper is that the Sino-Tanzania HIV/AIDS traditional Chinese medicine research and treatment project contributed to global health. However, modus operandi of the project defeated broader contribution to global health. And data for this study were drawn from archival materials in Tanzania and oral testimonies, both in Tanzania and China, as well as government reports and published research literatures. So now for the case of HIV/AIDS pandemic and Tanzania as a case study, we know that Tanzania reported its first case in 1983 in the Kagera region, which you can see it's at the northwestern part. And Kagera borders Uganda, where was the first to mention the first case in East Africa. So from Kagera, the disease spread to other regions of Tanzania. So after the emergence of the disease, there are several initiatives taken by the Tanzanian government. First, it encouraged local and foreign medical experts to embark into extensive research in both traditional medicine and biomedicine to find suitable drugs curing the disease. But second initiative was from 1985, it introduced several task forces to deal with the disease. However, up to 1987, the fight against HIV/AIDS was not yet generated promising results. So at this point, the Tanzanian government needed support from countries with more advanced medical knowledge to address the disease. About external support, regrettably, the international health agencies paid attention to primary health care, which was endorsed by the 1978 Almaty Conference. Therefore, HIV/AIDS was missing in the primary health care priorities and was perceived as less dangerous. So it was until 1986 where the WHO recognized HIV as a major public health concern, and it subsequently launched Global Program on AIDS, GPA, to deal with the disease. The GPA conceived HIV/AIDS as a behavioral program. Thus, it promptly transmitted behavioral education to raise global awareness. And the GPA approached HIV/AIDS in Tanzania in the late 1987. So now, how the Tanzanian government turned to the Chinese assistance. The Tanzanian government requested Chinese assistance to fighting the HIV/AIDS pandemic in March 1987, following Julius Nyerere's trip to China. Two reasons prompted the government's confidence to the Chinese. The first reason was the positive reputation of the Chinese doctors working in the country since 1968. And the second reason was inadequate measures taken by the WHO and other traditional global health partners to address the disease in the country. Therefore, in May 1987, health authorities of Tanzania and China signed a cooperation agreement, and in September 1987, research and treatment commenced. Traditional Chinese medicine experts who worked in Tanzania were recruited from different hospitals and institutes under the China Academy of Chinese Medical Science. The academy was established in 1955 and was reputed well for hosting famous traditional Chinese medicine specialists. However, its experts had neither engaged in HIV/AIDS research nor treatment prior to 1987. By the time being, there are no HIV/AIDS cases in China since the first cases were officially announced in 2001. Tanzania, therefore, marked the first place for the academy to research and treat HIV/AIDS. From its inception up to 2018, the academy dispatched to Tanzania about 16 batches with a total of 66 experts who researched and attended more than 10,000 HIV/AIDS patients in Tanzania. Now about the establishment of the clinic and the perceptions. The HIV/AIDS outpatient clinic was established shortly after signing the agreements, and TCM experts promptly started giving clinical care to patients. They started promptly providing clinical care because the experts conceived that HIV/AIDS was jointly caused by the invasion of wrong and bad QI from outside the human body and an intended discharge of right and good QI from within the body. Therefore, they believed that patients would recover if the two problems mentioned were adequately addressed by several formulae of herbs tested. Thus, they provided TCM drugs capable of reducing viral load and maintaining patients' body immunity. About the perception, throughout the 1980s and 90s, the TCM clinic was generally positively perceived, and it attended many patients. Nevertheless, the advent of Western ARVs in 2004 contracted the reputation of the clinic because many patients left the clinic and opted for ARVs. This context defeated acceptance and popularity of traditional Chinese medicine considerably and contributed largely for the Ministry of Health to call off the research project in 2006. The other aspect which I'm discussing in the paper is about the HIV research and treatment project and the medical knowledge exchange. And I'm saying that Chinese medical assistance to Africa was not intended as a simple transmission of funds and personnel, but it sought to promote self-sufficient in recipient countries. And this was reflected in the fourth principle for economic and technical aid referred to by Premier Zhuenglai in 1964. But also, this was emphasized by Premier Zhao Jiang in 1983. So I'm saying that such commitments made by these leaders imply that HIV/AIDS research and treatment project had to boost the capacity of Tanzania's health sector to enable the country to address the disease independently. I claim that the project would have boosted the capacity through the exchange of medical knowledge between Chinese and local experts. Nevertheless, the project denied the full inclusion of local medical doctors, as well as traditional medicine researchers and practitioners. Indeed, the manner in which the project was conceived reflects what Helen Thiele referred to as scientific diaspora. The Chinese government convened the HIV/AIDS project and introduced its scientific knowledge to Tanzania, where TCM experts controlled the project. I add that the dominance of TCM knowledge in the project was more or less the same as the approach employed by traditional global health partners, whose interventions to pandemics were empowered by faith in the superiority of their medical knowledge and technology. And here I'm taking you back to the quotation I started with in the introduction. The last aspect I'm discussing is about effectiveness, distinctiveness, and ending of the research. I'll be brief in this. About the effectiveness, the medical analysis showed that many of the formulae were 40 to 50% effective in fighting HIV/AIDS. I interviewed Dr. Naomi Mpemba, who also worked at the clinic for more than 20 years, and she informed that the herbs used were somehow useful in reducing the viral load to patients. So therefore, it's evident that Chinese herbs improve the patient's quality of life by alleviating common diseases such as fever, abdomen pains, cough, asthenia, and severe diarrhea, hence lengthen the lives and reduce death rates of HIV/AIDS patients. About distinctiveness, and here I was trying to see how it was similar or different to the Western-made ARVs. And the interviewees have mentioned that traditional Chinese medicine intended to defend patients' immune system, which were more susceptible to HIV, while by contrast, ARVs focused on the suppression of HIV. So since traditional Chinese medicine did not focus on getting rid of the virus, it was less effective in improving the health of patients whose body immunities were severely affected by the virus. The research project ended up in 2006, and they endorsed for patients use one of the 4 user formulae with the brand name Erin. And since its production was made in China, the medicines were regularly imported based on patients' demands. So in conclusion, I'm saying that the use of traditional Chinese medicine in fighting HIV/AIDS was an imperative attempt in promoting innovation and practice of medical knowledge from the South. Although the research project was less successful and had a modest contribution in boosting medical knowledge, to local researchers and practitioners, its practice and acceptance proved the strength of non-Western medical knowledge. The HIV/AIDS project was vital for China's economic and scientific achievements in a competitive global context. Admittedly, the research on HIV/AIDS and other chronic diseases contributed significantly to China's experience and scientific development of medical research. Thank you very much.